Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everybody. Happy Friday. It is 9 o'clock on Friday, and you are watching me, Deb Burton, Executive Director of RI Elder Info, the 501c3 nonprofit that brings you and someone you know information that you really need. And today I am having a deeply personal conversation with a friend of mine. So I understand if you may need to hit pause in the conversation and return to it. But what we're discussing is something that many people experience, but maybe don't necessarily share their story. So again, it is deeply personal, and it is something that may be emotional for some folks. So I just want to make you aware of that. But it is in a very important conversation for all of us to hear and understand. Now, as you know, we are a nonprofit, and we could not bring you this information without the support of our individual donors, our sponsors, and all of our supporters. So a big thank you to United Healthcare, as well as Brightside Behavioral Health, and a special shout out from McCarthy Law. Here's a message from McCarthy Law.
Here at McCarthy Law, we practice in the areas of estate planning, long-term care planning, elder care law, and residential real estate. Our focus is really on providing peace of mind to our clients.
If you're interested in scheduling a consultation with our office, you can feel free to reach out to us at 401-541-5540. You can also reach out via website at www.mccarthylawri.com. You also should check out our social media, both on Facebook, Instagram, and LinkedIn for some helpful tips and tricks.
Welcome, Patty Markham-Rissica. How are you?
I'm great. How are you?
Very good. So for those who don't know, Patty has been the Associate Professor of Behavioral and Social Sciences, Associate Professor of Epidemiology at the Center for Health Promotion and Health Equity, Director of Undergrad Studies over at Brown University School of Public Health, and you are also the Advocacy Chairperson for the Rhode Island Public Health Association. But for me, you are one of my former bosses when I was at the Brown University Institute for Community Health Promotion before it became Brown Public Health, and a friend. And you have been sharing your personal journey on social media. And in reading it, I realized that there are many people who need to hear your story. So I'm not real sure where to start, but I know that it was very exciting last summer watching you learn horseback riding, something that is actually something I am very interested in learning about. So I was living vicariously through you. So if you want to start maybe last summer and share your story.
Sure. Thanks so much, Deb, for having me and giving me the space to talk about my journey. It's been a crazy year. So last year was a great summer, great year, great spring. My daughter actually was married in the winter last year, and we had a big family gathering around 4th of July. And before that, I wasn't feeling great. I knew there was something not quite right, and had been to see my primary care doctor and said, there's something right there. I don't know what it is. And, we went through a series of tests with her and came to the conclusion in June, probably, late June, that she didn't have the answer. And I needed to see some specialists. And I had already, said, I agree. I need to see GU, which is genitourinary GI, so gastrointestinal, and then also GYN. And interestingly, she agreed. I reached out and had contacts, and she shared some with me, and it was very difficult to get an appointment, and I literally had to say, both the GI person said, "Well, you're not really due for a colonoscopy till December." I said, "What if I have symptoms?" "Oh, well, what symptoms do you have?" So I discussed with them, but they could only get me in 6 weeks. And then the GYN person, same thing. "Your provider isn't available. We don't have anybody." I said, "I'll see anybody. I'll see whoever you have available." Couldn't get me in. Literally, it was the day before the GI appointment. The GU person couldn't even see me till September. So, and they, again, I'm telling everybody, raising the red flag. I have some symptoms. We don't know what they are. So I need to get in.
And you're an educated person. Like, you have a lot of letters after your name. You are a public health advocate. So, like, you know how to raise the red flags, and you are still having the challenges of being able to get those appointments when you really felt like something was wrong.
100%. And my husband is a physician. Now, he does ear, nose, and throat, so nowhere near the part of my body that was not feeling well. But he kept saying, "Yeah, you got to get in to see somebody." And I was doing that. I was doing, what we're told to do, which is make sure, you advocate for yourself and make a point of saying, something's not right. I can't wait till December. I can't wait many months. And I wasn't agonizing. I was living my life. I'm having this party for my daughter. Like you said, I'm horseback riding, which I absolutely love. But, you would think that if I was, really ill or had some major problem, that would not be possible. Right. So, and I said that a whole bunch of times when I finally got in to see doctors. I'm like, how is this even possible? I was in a horse show 2 weeks ago, or I was, doing whatever, I was going to the gym. I was being very active, and that did not seem impossible, which was kind of crazy. So anyway, fast forward to the end of July, when I finally did get in to see the GI and the GYN folks. And it was kind of nuts, because the GI person said, well, I had to see them in person before they could do a colonoscopy, which is fine. And she said, "You might have something like diverticulitis." And I was like, "Oh, thank goodness." That would be wonderful. I hope something like that, because it's very treatable, right? But she said, "We can't do a colonoscopy if that's the case, because the tissue is very friable, and it can be dangerous to have a colonoscopy in a time when your colon is really inflamed and has a problem like that." So she said, "So I'm going to send you for a CAT scan just to see what we can see from there before we do the colonoscopy."
So you had this lower abdomen pain, and you talked to the doctor about that, and they gave you that information. So if somebody else watching is having that experience, don't skip going to the doctor. Go to the doctor and have the conversation.
100%. And again, I had already had this conversation with the primary care doc. She had examined me and said, I don't know what that is. And, so if we worked through, was this urinary tract infection, and, checking me out for that kind of thing, which is a little bit more straightforward. And it was definitely not that. They didn't, and they tested me twice for that, and that was not the case. So seeing the GI person, she said, "You need to go for imaging." And now, mind you, if we rewound to the prior fall, I had my regular checkup with my GYN, which I have every year. And, so one would think, I had already been checked out within the year. Which later my husband said, "Well, I'd like to see the report from that." But unfortunately, this kind of cancer can come quickly, sooner than within a calendar year. So I went and got the imaging that the GI person had asked for, and right away, she knew that this looked like it was ovarian and that it was large. And so she, immediately said, obviously, colonoscopy is not what you need. And I saw the or the GYN person also. Amazingly, they still weren't sure, which was kind of amazing to me in getting my exam. So I think that's another important point, getting multiple points of view when there's something sort of weird and mysterious, or, that isn't really obvious what it is. Multiple people advising is important. And at that point, this was the other amazing thing. We decided to look at Dana-Farber, which is well known to be a great cancer hospital, and their website, I was able to put in what I knew, which wasn't much. And within 3 hours of that information being entered in, I already had with them an appointment for another CAT scan and some blood work, and then also an appointment with the GYN surgeon who ended up being my surgeon for the following week. And so,
and you knew to do that with Dana-Farber because of your background.
I mean, I think a lot of people in New England know that Dana-Farber is well known to have great expertise in terms of cancer. I also think my public health background helped me to know that ovarian cancer is pretty rare. And I wasn't sure that I wanted a local, I am in no way saying that there's anything wrong with the local providers, but ovarian cancer is a lot more rare than many. And I was worried about, wanting to have as much expertise as absolutely possible. I unfortunately, years ago, back in 2016, had breast cancer, and had already gone through treatment for breast cancer that ended up with one side have a mastectomy, a unilateral mastectomy. And I had been treated for that at Memorial Sloan Kettering in New York. And part of the reason for that was one of my husband's good friends from his training is actually a breast reconstructive doctor at that university. So I was very familiar and comfortable with his recommendations as to who would be great help. We decided we did not want to drive to New York for that care, but just because, literally just because it's more hassle to drive into New York and easier to drive into Boston. I am incredibly blessed that my husband was available and very willing to drive me wherever I wanted to go, and has unfortunately worn a path from Rhode Island into Boston, knows the path well, but he was very supportive of, yes, let's go to Dana-Farber for your care.
Wow. And
yeah,
we've really touched the tip of the iceberg. And I know that your time today is limited. And I want to invite you to come back on to continue the rest of your story, because I think just what you've shared, that you were working in it's celebrating your daughter's wedding, having the big 4th of July event, showing horses, and you knew something was wrong, and you persisted, and yet it took a long time before you were able to get an answer as to what it might be. And so we can continue if you'd like, or if you want to come back on and continue your story at another time, it's up to you.
So we can continue the conversation for today. I have something else in like 15 minutes. So if you want to, you want to continue the conversation for now, I'm sorry if I'm a little bit too verbose in some of my answers.
No, you're good. You're good. So when you got the news that there was something that they saw, what was that like? as I'm assuming you were sitting in the doctor's office, or did you see it pop up in the medical portal? Like I imagine that would be like a punch square in the face.
It was devastating. And honestly, I had been to my GY or my GI person is out of Westerly. And so I had been to Westerly Hospital for a CAT scan with contrast and to have some blood work done. And after, the CAT scan with contrast is, it's sort of a long process because you have to drink the contrast over an hour. And anyway, it's a to-do, right? And so I left the hospital. I did not even get out of the parking lot. I was sitting in my car and I can't even remember. I think I was texting my husband and my phone rang and it was the GYN doctor or the GI doctor. And she said, the radiologist called me. I need to talk to you. Can you come back to my office? Are you still around? And I said, yeah, I'm like 2 blocks away from your office. And she said, can you go back in and get one more blood test? I'm going to call it in right now. I'll order it right now. And then come to my office and I'll talk to you in 15 minutes. And I said, okay. So I went back in and I already knew this is bad. This is not good, right? So I went back in and they drew another tube and I said, what did she order? And I knew, I'm like, I know asking this question is going to open Pandora's box, but I want to know. And they said, yeah, she ordered CA 125. And I'm like, because
what is CA 125?
I knew that CA 125 is a marker for ovarian cancer and some other cancers. It is sort of like a PSA is for that they follow for prostate cancer for men. And so I was just clearly, I knew this was bad. So I called my husband and I said, she wants to see me right now. And she ordered a CA 125. And he knew also this is really bad. So I said, I'll call you back when I get to the office. And I'm the kind of person that in an emergency situation, I can hold it together pretty good. I mean, I'm the person you're going to want if there's something going down that needs, focused concentration now, and I'm going to fall apart later. And this was one of those where I'm like, this is bad. This is really, really bad. So I drove literally the 2 blocks to her office, went in, I had to wait a couple minutes. She said, I have this other emergency I'm dealing with right now, but I will be with you in 15 minutes. I'm like, okay, take care of that person. I don't, not trying to rush through, but I knew it was bad. So we literally, from an exam room, we got my husband on the phone because I didn't want to have to say this or have her say it again. And he knows her well. And so we got him on the phone and she said, it's a tumor. She said, there's a mass. I'm pretty sure it's ovarian, and the CA 125 is, so normal is like, I don't even know what the normal is, but it's like, say 70. And my CA 125 was like 1500 or some insane number, right? It was like, off the stratosphere. Yep. So I knew then, and, I was in tears. My husband's, he held it together too. I mean, again, he's a physician, so he's normal, expecting the worst after what I'd already told him. So it was bad. It was pretty devastating, but we had an idea already of what was going on right at that moment. And that was a Thursday, I believe. And then literally the next morning, we were just processing of, this is really terrible news. But the next morning, all right, what are we going to do? And that's when we went on the Dana-Farber website to figure out, and it couldn't be easier to just put in your information and get some what of a plan, literally within a couple of hours.
When you were sitting there in the doctor's office with your husband on the phone, what was your experience like when that visit is done and you have to walk to the car?
Yeah.
Like, I tried to envision what that must have been like. Or is it just kind of like a fog because you just pretty much got punched in the face by bad news?
Yeah, it's very much like that. Foggy. I wanted to try to, keep it together to drive safely, half an hour home. And part of me was thinking through, this is bad, but I mean, I think for driving, a lot of times we can go into autopilot, which is great in a way if you have some experience. And thankfully there was nothing too interesting to see or bad traffic or anything like that. It's pretty, I mean, of course it's devastating news. I knew that it was devastating news. I knew that, this is really bad. And so part of it is I'm in such a panic in that way, knowing that this is going to be really bad. There's nowhere to go with that. I don't know how bad, I don't know, but I'm driving myself, I was just at work. I just was, at a horse show. I was doing all of these normal things in my life. I'm walking myself to, I'm not in the emergency room or anything like that. So it's a little weird in that way to be still highly functional and able to take in this information and drive myself home, but yet carrying that with me, knowing, I mean, I was really glad my husband already knew. So I'm going to get home and, commiserate with him, but I didn't have to get home and tell him. We did have to then have some conversation about, like, when are we going to tell our daughters? And we have a friend who had cancer and literally did not tell their adult daughters at all. And we talked about it, months before when our friends made that decision. We were like, first of all, I think my kids would kill me.
Your girls would not be happy.
They would not be happy. But also, I don't think I could carry the burden of that kind of information around and not have shared it with them, to be going through something like that and not tell the family, to me seemed nuts. So we, immediately went into also, all right, when are we going to tell our family? And I think we decided to wait to tell the extended family until the following week when we had been up to Dana-Farber and had some knowledge, but we told our kids right away because I'm not very good at hiding things either. I'm just not going to be very good at that. But also I think they would want to know and be on that journey with us and supporting us and not just find out later. They're not interested in the clinical as much as they're interested in me, as a person.
You're their mom.
Right.
That's what matters.
Right.
That's all that matters for them. So, my friend, I would like to have you back on because that was last summer and you have been through so much, and your journey is amazing. And I feel like you've already helped a lot of people understand that it is not easy. And even when you have the public health background, when you can understand you have a medical provider in your family, at the end of the day, you are Patricia, you are wife, you are mom, you are family member, and everything else gets stripped away. And it's trying to figure out what now. And so what you've shared in social media has been very remarkable. And I hope that you will come back on and kind of continue your story, because I feel like there's a lot of people who have this experience and feel like they're alone in it. And you're sharing that they're not alone. And that can make all the difference for a lot of people. So if you would.
Yeah, I'm happy to come back and talk about how this all played out, and so many aspects, the medical aspect, professional, personal aspect. It's been quite a journey, quite a 6 months, completely unexpected.
Yeah. And as a public health advocate, what advice would you give to people if they're just not feeling right?
Yep.
What 3 things would you tell someone to do as a public health advocate?
Right. The number one thing is be your own advocate. Absolutely. When you're not feeling right, raise the red flag, meaning call your doctor, make sure you get seen. If you feel like they're not completely understanding, say it again, maybe find a different doctor, whatever you need to do to keep going until you're getting heard. Women are famously not listened to, and this is not to blame any single individual in health. It's a fact. We know that. But also, sometimes symptoms are weird and not specific, and so you have to keep saying it, even if what you're saying is like, there's something there. I don't know what it is, because the idea is you have to go in knowing what you need, which never happens, right? I mean, we don't know what we need. And especially when you're having some weirdo symptom that doesn't seem to fit with anything, raise the flag. So be your advocate and keep going, pushing for, I need more, and I need to be seen. If I hadn't said I need to be seen, I'm having symptoms, I need to be seen sooner, it would have been months later, and it would have made a giant difference in terms of my likelihood of survival and just what needed to be treated. As it was, the delays in care, because it was so nonspecific and because they couldn't get me in for, a few weeks, whatever, very likely already made a difference in my care. But if I hadn't even continued to press for being seen as soon as possible, it would have been worse. So be your own advocate. And it's okay to feel like you're pressing the medical system, your provider, their office staff, to do something that they're not necessarily comfortable with. Get seen sooner, but you have to be the one to be your own advocate. And sometimes being an advocate for another person is really helpful, but you got to be the squeaky wheel in order to make sure that you're getting seen. This whole concept of, I don't want to embarrass myself, it might be nothing. Yep, maybe. God, hope it is nothing, but it may be something really bad. And even if you're not feeling right, you got to be that squeaky wheel and keep pressing.
I love it. Thank you so much for coming on today and sharing your story. And I welcome you to come back and continue, because it's quite a story.
Awesome. Thanks for having me.
Thank you. I will let Ben know that we have ended.
Okay.
Well, everybody, this was an amazing conversation with my friend Patty today. She has shared her very personal story, and her story continues and is very enlightening and educational. So I am really looking forward to continuing my conversation with her on another day. And I hope that you found this helpful for yourself and for your loved ones, and really take home the message that if something doesn't feel right, keep pressing on, keep advocating for yourself, because can make a difference, literal life or death difference. I am so glad that you are all here with us today, that you have watched today. I hope that you have shared this out, because this is a story that I don't think we often talk about enough, that sometimes something isn't quite right, and maybe we're a little hesitant to keep pushing the medical community, but we need to for our own health. So please help us get the word out. I look forward to seeing you all again next week. In the meantime, be well and be kind.